If you've been told you have Hashimoto's or suspect it, and have been told that your thyroid levels are managed, but you still feel exhausted, foggy, or inflamed, there's an important distinction that we need to make. Hashimoto's is not just a thyroid story. It's your immune system expressing a larger pattern, and when we only focus on the gland itself, we could be missing what the body is actually communicating. I'm Dr. Kenny, an IFM certified functional medicine practitioner, and my work centers on helping people connect the dots and get to the root in a clear, evidence-informed way. If you appreciate content just like this, let me know by liking the video. I'll make more just like it. So let's start with a distinction that changes the discussion around thyroid conditions. In Hashimoto's, the thyroid is usually where the problem becomes visible. It's where the labs change, it's where the antibodies show up, and it's where the hormone conversation often begins. This is why when I'm having discussions with patients, I sometimes refer to the thyroid as the functional scapegoat. And not because the thyroid is irrelevant, it absolutely matters, but because the gland itself is often reacting to signals underneath in your chemistry. In other words, the thyroid becomes the place that the body leaves the most stark evidence. And that evidence matters, and the treatment matters. But if we stop the conversation there, we can miss the deeper physiology, the deeper function, the deeper why that helped to create this autoimmune pattern that reflects in the thyroid in the first place. That's really the shift that I want to explore in people with Hashimoto's or suspected thyroid issues on a spectrum. And this shouldn't be oversimplified to ignore the thyroid, but rather we shouldn't mistake the thyroid for the whole story. It's not acting alone or in isolation. It's responding, and it's becoming the collateral damage in a larger systems-based immune process. So why would your immune system begin targeting your thyroid in the first place? Because nobody is born with Hashimoto's. To answer that, let's talk about an important concept in all of autoimmunity, but especially Hashimoto's. One of my favorite phrases, immune tolerance. Your immune system is constantly making judgments from birth till death. What is safe? What is foreign? What needs a response? What should be left alone? The ability to recognize your own tissues as self and avoid reacting to them is called immune tolerance. When all is working as it should, the immune system turns against real threats without reacting and turning on the body. But when you lose tolerance, the system ultimately becomes more vulnerable to confusion. And one of the ways that confusion occurs is through a process known as molecular mimicry. Molecular mimicry is an interesting process that basically means a molecule of something, whether a virus or a bacteria or a food, or an environmental allergen, resembles molecules of your own tissues closely enough that the immune system begins reacting to both. So your immune system is not trying to attack your thyroid gland for no reason. It's reacting to patterns that it started interpreting incorrectly. And that matters because it shifts the conversation away from the question, why is my thyroid failing, toward why is my immune system losing its precision? And that's often a much more useful and clinically actionable question when it comes to Hashimoto's, but also other autoimmune conditions. Because once the immune system starts to lose its precision, this is where our own tissues, like the thyroid gland, can become caught in the crossfires. The thyroid may be the organ that is affected and under attack, but the deeper issue is the loss of tolerance that allowed that attack to become possible. And that kind of immune system drift does not happen in a vacuum, and it's not inevitable either. There are certain environments in the body that strongly influence whether the immune system stays regulated, precise, and tolerant. One of the biggest and most important environments is the gut. There's a reason we have termed this pathway the gut immune pathway. When we talk about immune system behavior, such as with Hashimoto's, one of the most important environments to tune into is the digestive tract. This might seem surprising at first, because when most people think about thyroid disease, they think about fatigue and energy or brain fog and weight loss issues, or they think about hormones or the organ in your throat. But the immune system sees the body very differently. Nearly 70% of the total immune activity body-wide takes place along the digestive tract. This area is sometimes called the mucosal immune system, and its job is to monitor everything that enters the body, such as food or environmental exposures. At the same time, that intestinal lining acts as an important barrier. Think of it as a very selective border crossing. Broken down nutrients are generally allowed through. Potential threats or undigested food particles are supposed to stay out. When that barrier is functioning well and intact, the immune system receives clear signals about what is safe and what is not. But if that barrier becomes more permeable, a situation known as intestinal hyperpermeability or leaky gut, that situation of calmness changes. Bacterial fragments or undigested food particles or environmental toxins may be able to get through, and they interact with your immune system cells more closely. That extra exposure can increase your overall immune reactivity and lead to reduced tolerance over time. And interestingly, human research is starting to reflect this exact connection. A 2023 systematic review and meta-analyses examining people with autoimmune thyroid disease found consistent differences in the gut microbiome in people with Hashimoto's compared to the control groups. Or said another way, the microbial ecosystem in the gut in people with thyroid autoimmunity share some similar patterns. Now, that doesn't mean that the microbiome is the sheer cause of Hashimoto's, because this can't establish a causal relationship. But it does reinforce something important, and that is the immune system is responding to signals from multiple environments in the body, and the gut is one of the most influential environments. But the gut in autoimmunity is not operating in isolation either. There's another system that quietly shapes your immune behavior every single day. This system is your stress response network. Your body has a fascinating built-in system that is designed to help you adapt to stressors. It's called the HPA axis, which stands for the hypothalamus, the pituitary, and the adrenal glands. Together, these structures coordinate how your body responds to different stressors, whether emotionally perceived or not. We're talking about stress chemistry here. They regulate cortisol, they influence inflammation, and they ultimately help the body shift to survival when needed. In short bursts, this system works magnificently. It helps you wake up in the morning, it helps you focus during particularly difficult tasks, and it helps you respond quickly when something demands your attention. But modern life rarely delivers stress in short bursts. Instead, many of us are experiencing layered stressors day after day. Poor sleep quality, pressure from work, financial strain, persistent infections, negative self-talk, political pressure and prejudice. When these pressures accumulate over time, the body begins to add to what's called your allostatic load, or the total body burden of stress. Another way to think of allostatic load is as the cumulative wear and tear created by chronic adaptations to stress chemistry. And that load doesn't just affect your mood or your energy, which it does and are very important. It also influences your immune behavior. It influences inflammatory signaling. And ultimately, it can influence how the immune system regulates tolerance. There's even clinical research that suggests that stress chemistry interacts with autoimmune thyroid disease. In one randomized control trial involving women with Hashimoto's, participants who completed an 8-week stress reduction program experienced improvements in their stress and their psychological health, along with favorable shifts in their thyroid antibody measures compared to the control group. In other words, your stress response system and thyroid autoimmunity are not separate conversations. We are deeply interconnected beings. And the big idea here is that when multiple stress signals accumulate over time, they can create the kind of instability that allows for autoimmune patterns to develop. So now we've talked about several pieces of the autoimmune puzzle: immune tolerance, gut balance and signaling, as well as stress physiology. If so many systems can influence thyroid autoimmunity, why does the thyroid itself become the primary signal that we notice? The answer here is surprisingly simple. The thyroid is one of the easiest endocrine organs to measure. We can check hormone levels, we can check for antibodies, and we can track changes over time with fairly accessible blood tests. So when the immune system starts shifting toward a state of autoimmunity, the thyroid often becomes one of the first places that it becomes visible. Not necessarily the first place where this shift began, as we've learned, but the first place that we can clearly track the clues and see the evidence. But here's an important nuance. Even when your thyroid hormone levels appear to be within normal range, the autoimmune process itself can still influence how people feel. A 2021 systematic review and meta-analysis found that individuals with the antibodies for Hashimoto's may experience reduced quality of life and an increased burden of symptoms, even when their thyroid hormone falls within normal thyroid ranges. So in other words, somebody's labs may look normal on paper, but they can still show the signs and symptoms of Hashimoto's or thyroid disease. This helps to explain a pattern that I see frequently in my Hashimoto's patients. They're told that their numbers are fine and their medications are dialed in, and yet they're still fatigued and foggy and unable to do the things that they love. From this systems-based perspective, that disconnect makes a lot of sense because the thyroid hormone number itself is just a snapshot, and it's a downstream manifestation of the autoimmune process that is happening in the multiple systems that we've discussed. So if the thyroid is the measurable signal that we're looking for, the next step may be to interpret that signal more carefully. This is another situation I see in my patients with Hashimoto's, or even those who show symptoms but have been deemed normal. In conventional medicine, thyroid screening typically begins with a single blood lab measure. That is TSH. TSH stands for thyroid stimulating hormone, and it's produced by the pituitary gland in the brain to signal the thyroid when more thyroid hormone is needed. TSH is useful, and it definitely catches the extremes, but it's also an indirect signal, and it only captures one snapshot in time. It tells us how the brain is communicating with the thyroid, not necessarily everything that's happening within the thyroid itself. That's why in functional systems-based healing, we often expand the picture. A more detailed thyroid panel can include markers like T3, T4, reverse T3, and thyroid antibodies, including TPO and thyroglobulin antibodies. These measures help us to understand different aspects of thyroid function: how much hormone is being produced, how much is being converted into its active form, and whether or not the immune system is targeting the thyroid tissue. Because once Hashimoto's does appear, the experience is rarely limited to just the thyroid itself. It's important to start looking at the systems around the thyroid that shape immune system and tolerance behavior. For example, stress patterns and the HPA axis becomes relevant. Your gut health and microbiome signaling, as well as the barrier integrity, are important. And your overall metabolic or energy production resilience is also key. Even environmental exposures can matter. Toxins and even protein like gluten have been implicated in the development of thyroid disease. And the bigger question becomes, how much did that single toxin influence this experience? And how much has to do with these deeply interconnected systems that we've discussed previously? It can be quite exhausting trying to chase every single variable. So I tend to turn focus to the larger patterns of tolerance and resilience across systems. Because when you start to look at Hashimoto's and autoimmunity broadly through this systems-based lens, the thyroid stops looking like an isolated failure. Instead, it represents a signal that is begging a deeper conversation. So if the immune system is reacting to signals and the gut is home to many of those signals, then understanding what stabilizes the gut barrier becomes incredibly important. And that's exactly what this video goes over next. And it helps to clarify why gut function sits in the middle of many autoimmune discussions. I'm Dr. Kenny, Root Cause Health Detective. Thank you for watching, and I'll see you in the next video.